Good morning everyone. I am Dr. Monica Gupta. Today we are going to discuss on early warning signs of endometriosis, what every gynecologist should know. Endometriosis is a chronic gynecological condition that affects up to 10% of reproductive age group. Despite its prevalence, diagnosis is often delayed because it is difficult to diagnose by common modalities. Awareness of early warning signs is crucial to ensure timely diagnosis and management. We can diagnose this disease by history taking, and the most important point in that is severe dysmenorrhea, that is painful periods. Period pain that is more severe and prolonged than typical menstrual cramps. It starts from menstruation and persists throughout the cycle. It is resistant to normal painkillers and hormonal treatment. Second important feature is chronic pelvic pain. It is persistent or cyclic pain in the pelvic region lasting 6 months or longer. Pain can occur independent of menstruation and worsen with time. Third important feature is dyspareunia, that is painful intercourse. There is a pain during or after deep penetration. It is due to endometriotic lesions on uterosacral ligament, pouch of Douglas, or ovaries. Patient can present with menstrual irregularities like heavy menstrual bleeding or spotting or intermenstrual bleeding. Infertility or subfertility is also very common. Patient can have difficulty in conceiving, and endometriosis is a leading cause of infertility due to scarring, inflammation, or anatomical distortion. Patient may have bowel and bladder symptoms, painful defecation or urination, particularly during periods are common. Patient may have diarrhea, constipation, bloating, blood in stool or urine. Symptoms can mimic IBS or UTI. Patient can present with fatigue and malaise, unexpected fatigue that worsen around menstruation, often underestimated but significantly affects quality of life. Patient can have low back pain and leg pain. Pain is radiating from back or legs, mimicking musculoskeletal issues. It is often cyclical and exacerbated during menstruation. In case patient is having family history of endometriosis, in first degree of relative, incidence of endometriosis is high. In adolescent girl, early onset dysmenorrhea resistant to NSAID and hormonal therapy, and if the patient is having chronic pelvic pain, we can make a differential diagnosis of endometriosis. When to suspect endometriosis? When symptoms do not improve with standard treatment for dysmenorrhea or IBS, recurrent visit for vague pelvic or abdominal pain with no clear diagnosis, a history of difficulty in conceiving combined with pelvic pain. How we can diagnose? Foremost is the clinical history. Detailed history about menstrual cycle, pain history, and family history are important. In imaging, transvaginal ultrasound can diagnose endometriomas, and MRI are needed in advanced cases. For definite diagnosis, laparoscopy should be done, in which we can visualize the lesion and we can take biopsy also. For management, early referral for the cases with persistent symptoms or suspected infertility should be done. Multidisciplinary management, collaboration with pain management specialist, reproductive endocrinologist, and mental health professional. We have to educate and support patient, encourage patient to track symptoms and provide counseling about the condition. Early recognition and proactive management can significantly improve outcome for patient with endometriosis. Thank you very much.